Hey guys, I wanted to take a moment to go through the difference between SVT and atrial fibrillation because this is something that keeps coming up. So I thought I'd put together a short lecture on that. So let's first look at what are SVTs. So SVT in general means any supraventricular tachycardia. Okay, here as you can see, the S is the supraventricular tachycardia. So supra meaning above the ventricles in a fast rhythm tachycardia. So what does that mean, and how we differentiate these? Okay, if you imagine your heart, we'll use our box diagram. Okay, this being the right atrium, left atrium, right ventricle, and left ventricle. Okay, you have your conduction system that comes down and splits off. When we talk about supraventricular arrhythmias, we're talking about those that are above the ventricles. Okay, these are the ventricles. These are the atria. So anything that's coming from the atria or the AV junction tends to be a supraventricular tachycardia. So I've listed some examples here: sinus tachycardia, inappropriate sinus tachycardia that can occur often in women, atrial tachycardia, multifocal atrial tachycardia. Notice all tachycardias, meaning rates over 100, fast ones. Atrial fibrillation with RVR, okay, and we'll discuss that. Atrial flutter if it has a fast rate. Okay, AV reentrant tachycardia, AVRT, or AV nodal reentrant tachycardia. And in our course, we kind of hit on all these different features, why they're clinically significant, and the pathophysiology. Okay, we won't go through that all here. My main focus is, and what I wanted to get across is, what is the difference between atrial fibrillation with rapid ventricular response, or RVR, and SVT? Okay, now even though these are all SVTs, we tend to think of SVTs a little differently clinically, okay? So atrial fibrillation, the one we know often more about, okay, with RVR. So when we say with RVR, that just means a rate over 100 beats per minute. The RVR, okay, or that latter portion, whether it's CVR, controlled ventricular rate, or SVR, which is slowed ventricular rate, that's how we classify atrial fibrillation, okay? Remember, if it's less than 60 beats per minute, we call that AFib with SVR, slow ventricular response. If it's over 100, as we have here, that's RVR, and then controlled ventricular response, or just atrial fibrillation, is between 60 and 100 beats per minute in our adult patients. So AFib is an indiscernible rhythm that has absent P waves, where we can't really make them out. They're not fully there, okay? And it's an irregular rhythm with a rapid ventricular response, okay? This is AFib with RVR, okay? So that latter portion where we say rapid ventricular response over 100 is because we're talking about the RVR. Now, when we look at SVTs, again, a tachycardia, so a rate over 100 beats per minute, and this is a regular rhythm, okay, a regular rhythm. Narrow QRS complexes, unless there's aberrant conduction, okay, so that's one thing to keep in mind, and that's where we run into trouble with trying to differentiate SVT, so a supraventricular tachycardia with aberrancy, and VT, ventricular tachycardia, okay. Still, the criteria, the algorithms that are out there to decide if this is VT or not are very poor, I would say, at best, okay. We're working on new algorithms that we're developing here at Mayo Clinic that are actually much better, okay, and we'll share a little bit on that soon as that starts to come out. So anyways, back to here. So with SVT, when we think about this, this is a regular rhythm with a rate above 100 beats per minute. Notice we said with atrial fibrillation, this was an irregular rhythm, okay? So that's going to be your main clue of differentiating them. Now, in terms of SVT, the P waves may be buried in the QRS complex or T wave. So I wanted to show you an example of both of them because I think it's best when we can actually see what we're talking about. And this is an example of AFib with RVR, okay? So the rate here is over 100 beats per minute. And how do we know that? Remember, this is from a 12-lead ECG, so we know this is 10 seconds in duration, meaning from beginning of the ECG all the way to the end is 10 seconds, okay? We know that if we multiply 10 seconds times 6, this is 60 seconds, which is 1 minute. So if we count the complexes going across, multiply by 10, we can get the rate. So if you do that here, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, okay? And what you would do is then do 21 times 6, and 21 times 6 should give you 126, all right? Hopefully my math is right, and that is over 100 beats per minute where we get the RVR, okay? And notice that we can't really make out any P waves in the regularity, meaning the difference, these R to R intervals are all different between each one, okay? There is no regularity to this. Notice this one's shorter, okay, and a little different than the one follows, and so forth, okay? And remember, AFib is where we can have the aberrancy and see the Ashman phenomenon that we discuss more in the course. So anyways, that's AFib with RVR. The other one down here was the SVT, and remember we said the differentiating factor was that this is a regular rhythm, okay? So even though you have the baseline that kind of comes up like this, that does not make it irregular. It's this portion. So if you take these S waves, the S waves you can also use have the same distance between each one. Okay, and that's what makes it a regular rhythm. Same thing if you took these R waves up here. Okay, so that's all that. So, and remember, these P waves can sometimes be buried within somewhere in there. You can have that P on T phenomenon because the rate is happening so quickly, the P waves are buried in the T waves, okay? Sometimes they can also be buried in the QRS complexes. So just to recap, supraventricular tachycardias include both AFib, okay, and the SVT that we talked about, but they actually include all of these. Now, clinically, when we talk and differentiate them, and you'll hear more about them, this is what we tend to mean. AFib with RVR versus SVT. AFib, remember, an irregular rhythm. RVR, rapid ventricular response because the rate's over 100 beats per minute. And then SVT, this is a regular rhythm with a rate over 100 beats per minute. Okay, and the SVT can include AVRT and AVNRT that make up probably about 90% of them. Okay, so those coming from the AV node. And remember, the main thing when you're differentiating AFib from SVT in this case is the regularity. Okay, so remember that the AFib has an irregular rhythm and SVT has a regular rhythm. All right, hopefully that makes sense. Now I want to just take you to show you this, our EKG coding reference that we've been putting together here for our fellows, and I want to make available for everyone else just as a great reference to have on the go. So how you'll access this is that you'll go to the website that I've put here, and from there you're going to come to this page right here. It's a different color, so this page here, you're going to enter your email, so put your email here, and then you're going to enter the password that I've placed here, giving you my password, which is this one here, and you'll put that in here. There are no spaces between any of this. Okay, hard to read my writing here, not very good, so use this. This is the password, okay? The EKG Guy, AK, no spaces, all lowercase. All right, to make sure you're using your email. Now from there, once you place that and you go, you're going to get an email with an access link that's just going to confirm your email. Okay, and after that you'll be able to have access, and every time you come back to the page you'll use your email and this password here, but you won't have to go back to your email and do that every time, so just the first time. All right, and what that looks like, you'll have, there's 10 parts to it. As you can see, here's part 1, general features, P wave abnormalities, looking at atrial enlargement, what's a normal EKG, and this is how we code the EKGs here in the EKG lab. Okay, so this is things that we use to differentiate them. We'll have criteria on everything. So example here is sinus rhythm. What makes up sinus rhythm? An example of sinus rhythm. I'll start to add more examples, more lectures and things within there so that you can have things to refer to. And this is great to have it on the go, or if you're working in an EKG lab, if you're a tech, if you're a nurse, if you're a resident, you have it all there for you. Okay, and the other thing is we talk about rhythms. There's another section, so this section of rhythms has atrial, ventricular. We have different myocardial ischemia, infarction patterns, STT wave abnormalities, clinical disorders like Brugada syndrome, okay, pacemaker function, what is normal, what's abnormal, oversensing, undersensing, and so forth, and then some miscellaneous topics. There's a number of different ones, but there's 10 different sections. I want to make this make you aware of this because this is something that is new and we've put it together for everyone to have something on the go. Okay, we use this here for our teaching. So this is the EKG Coding Reference. Again, go to the website, put in your email, put in that password that I've provided. You'll say submit. You'll get a link in your email. Click it. You'll have access to all of this available to access on the go and anywhere you need. Okay, and I find this quite helpful. My memory is not very good, so I think having a reference like this, because there's so much that's always coming out, and we'll continue to update this so you have the best EKG reference guide available. Well, thank you so much. I hope you have a wonderful day.